Good morning. It is Tuesday, October 7th, 2025. I'm going to call our special meeting to order at 8:01 a.m. We're going to do the roll call. Present, we have Board of Health members Anthony Santella, Ken Lalim, Norman Weinberger, Joan McNeil, and Janet Karpiak. Good morning, everyone. We also have Norwalk Health Department staff members, Pam Bates, Daniela Fignon, Sarah Forrestal, Darlene Hoffler, and Brian Weeks.
This meeting is being recorded.
So,
That's us, guys.
okay. We also, all right, so we have everyone here. All right, our first item on the agenda is the regular meeting, acceptance of the minutes from the July 24th, 2025 regular meeting. Do I have a motion? I see Norman put his hand up. Do I have a second?
I'll second.
Oh, thanks. Thanks, Joan. Any comments, any edits on the minutes, any discussion? All right, hearing none, I'll call for a vote. All those in favor say aye.
Aye.
Any opposed?
Nope.
Abstentions? All right, they pass. Thank you. All right, the next item is the public participation. And I believe we have a member from the public here with their hand raised. So Ms. Lauricella, you have, as a reminder, 3 minutes to speak related to an item on the agenda for the Board of Health this morning. Good morning.
Good morning, everyone. I'm glad the IT department is helping you out this time because your time is very important, as is mine. I'm not sure what that is from.
Yeah, there was some feedback. Sorry about that.
Okay. May I go?
Yes,
for the record,
please.
yeah, my name is Diane Lauricella. I have an over 30-year professional background in environmental health and hazardous materials management and waste management, as well as good governance. The reason I wanted to speak today is under the agenda item for the epidemiology, but also immunization. I was very glad to read in the minutes from the summer that several of the Board of Health members felt it was important to find a strategy to actually go out into the public to discuss the work of this department, who's very important in our day-to-day lives in Norwalk. Board of Health, health has to do with a lot of things, mental health, physical health, etc. I was very glad to see a discussion with many of you, not just the usual suspects, but many of you stating that and encouraging the health director and the staff to find ways to tell the public what you are doing and how the public can stay safer or be aware of things so that they can make sure that they and their families are safer. So the reason I decided to speak was because over several years, especially during the pandemic, this is under epidemiology, I have felt that the department needed to get out more into the public. I asked what has happened to the public in public health. One of the things when you further discuss this item, and I ask maybe that you actually have on your agenda every month a section on public outreach for emerging concerns related to epidemiology or any of the other myriad of things you do in this department. And that means, what is the difference, as an example? What can help people that are laymen and busy laymen do to understand the difference in the types of masks used for COVID aerosol contamination versus surgical masks, which are better for droplets? Now, that's a generalization, but the public needs and deserves to know so that they can oops, so that they can make choices. I think it's coming from Ken Lalim's thing, but I'm not sure. Anyway, how can we have equitable air quality management and controls and enforcement? I know for a fact, because I've done professional work all over Norwalk for clients and for neighborhoods, I know that the air quality, which is a public health matter, but sometimes also a zoning matter and a building management matter, is handled differently in South Norwalk and parts of District A, which is Old Norwalk, than it is in Silvermine or Cranberry, which is a more countrified and I say less diverse. I'll be than in those other regions.
Ms.
What
Laura
kind of,
Chella, I'm sorry,
yeah,
you're at time. If you could please just wrap up the comments. Thank
I
you.
will. I also ask that any of you give me a call, and my 203-858-1537. Let's meet and let's talk about the different ways to do public outreach. Lastly, please consider on occasion or always having an evening meeting when the public can actually have the time to focus and meet on Zoom is fine with me, as long as you could see my face and see how sincere I am. So have a great day. It's going to be a beautiful weather. And I thank you for all your services, including the staff.
Thank you, Ms. Laura Chella. I don't think there's anybody else. Let me just double check. Nope. So we will close public participation. And next, we're joined by two of our staff members who are rock stars in the health department, Pam Bates and Sarah Forrestal. They are the leaders of our Immunization Action Plan program, and they do a lot of outreach into the community and working with physician offices on the importance of vaccines and a whole host of other things. So they're going to give a great presentation today. And Pam's going to be presenting. We're also joined by Darlene Hoffler, who oversees the program as well. So I'm going to pass it on to Pam, and we're going to have, Anielle's going to be able to pull up the slides. Thank you so much for joining us to present to the board.
Absolutely. Good morning, everyone. We can just go to the first slide. So CTWIS is, as we know, Connecticut's immunization information system, and it just celebrated its 7th birthday. I can't believe it. Nancy Sharova, the director of CTWIS, sent out this birthday announcement to the Connecticut Department of Public Health staff and the Immunization Action Plan teams, honoring this milestone, and provided the timeline before and after its inception. I thought that you all might like to see this amazing development. I'm not going to go through all the details, but thought I would point out some highlights. The impetus for the birth of the immunization information systems was the devastating measles outbreaks that swept the nation back in '89 to '91. And back then, immunization records were kept by paper. There was no system in place to share, monitor, or track this data and know the vaccination rates in a community. There is a story of a child who died needlessly during the outbreaks because her vaccine record was not available when she went to the clinic to get immunized. And in the time that it took for her to obtain her record, she contracted measles and died. And I'm sure this wasn't an isolated case. In Connecticut, the first, I'm going to coin it the IIS, Immunization Information System, started in Hartford by Joan Christensen Legay. It was a DOS-based voluntary registry out of Hartford Health Department. And this initiative proved to be a success, with rates increasing in Hartford from 52 to 78%. So because of this achievement, the IAP program was established to raise immunization rates throughout the state, with a goal of 85% for the primary series for preschool children. And in 1994, legislation enabled the Connecticut Department of Public Health to establish an opt-out childhood immunization registry called CIRTS that had mandated reporting by Connecticut providers. And children with Medicaid insurance were the first to be enrolled, starting with those born in 1995. And CIRTS was DOS-based. It required a fob to access it. It was a paper-driven system and required providers to send copies of their patients' paper immunization records to the state or the local IEP coordinators to data enter the vaccinations for preschool children at critical intervals when it was more likely that they might fall behind schedule. In 2012, CERTS migrated all of the data into a web-based IIS, Maven, and started onboarding the EHRs, the electronic health records, to report immunizations, which allowed for vaccinations to be reported beyond age 2. And then the next huge advancement in 2018 was migrating all of the data from CERTS into a web-based system, WebIZ, known as CTWiz. And this had advanced capabilities of ordering and managing vaccine inventory, generating immunization coverage reports, reminder recall functionality, and much more. And fortunately, we had this infrastructure in place before the COVID-19 pandemic, when all vaccinators were required to report COVID-19 vaccinations in real time. So during this time, the Connecticut Department of Health rapidly onboarded pharmacies, all other pediatric providers, adult providers, and any other medical facilities administering COVID-19 vaccinations. So through all this, CTWiz has evolved into a lifespan system, and at age 7, contains approximately 4 million patients and greater than 9.7 million doses administered. So if we can move on to the next slide. Here, Nancy just shows all the stacks of paper that used to come in from all the providers, from their compliance reports that had to be data entered into the system. Thank goodness we've progressed beyond all of that. And now the DPH runs monthly reminder recall reports in CTWiz for the providers for the same age groups that they used to get the compliancy reports for, when children turn 7 and 19 months, and then we do like a cleanup report at 24 months before we run rates. And as the vaccination providers are reporting vaccines administered to CTWiz in real time, the reminder recall reports only contain patients who are missing appropriate vaccinations. So the enhancements and advancements to the system will continue to support the DPH immunization program mission to prevent disease, disability, and death from vaccine preventable diseases in infants, children, adolescents, and adults through surveillance, case investigation and control, monitoring of immunization levels, provision of vaccine, and professional and public education. Next slide. Here are just some pictures of the milestones. You'll see on the left, Joan Christensen-Legay celebrated in 2013 as Connecticut's immunization champion for establishing that initial immunization information system. There was a CERTS video that used to run in the hospital waiting areas, informing new parents about the registry. There's a picture in the middle of some of the IAP coordinators back in 2017, when at one time the IAP programs covered over 22 areas. Currently, there are 8 IAP programs that cover 11 areas. And the Connecticut Department of Health covers the rest of the state. To the right is a current photo of the IAP coordinators and staff taken at a recent meeting. And then the next slide is just Nancy. She's always good about showing her gratitude and sending out wonderful, peaceful pictures, and a big thank you to the whole immunization program staff and the IAP program staff for their continued work each day on the system and raising immunization rates. And then the next slide, CTWiz immunization rates were recently run in June by the Connecticut Department of Public Health for the 2020 to 2022 birth cohorts. The rates represent the percent of children up to date with the combined 7 vaccine series. So it's 4 DTaP, 3 polio, 1 MMR, 3 hepatitis B, Hib vaccine age appropriate, 1 varicella or history of disease, and PCV, the pneumococcal vaccine, age appropriate by 2 years. And all of those have to be valid doses. A different calculation method was used this year compared to previous years. The percentage rate numerator is now established using CTWIS generated clinical decision support for immunization data, rather than COCASA, which is a software application that we used to use to run rates for clinics, rather than that logic. The up-to-date status is still based on ACIP recommendations, and the percentage denominator used now is the census rather than CTWIS data, as this was found to be more accurate. There is always the potential for duplicate records or inaccurate entries in the system that can skew the actual number. And then the next slide. So this first set of rates show the statewide rates for the 2020 to 22 birth cohorts for the 7-vax series. And you can see there's forward progress each year. And then the next slide is the comparison of the IAP area rates for the 2022 birth cohort. So you can see that the Norwalk area rates are the highest in the state, followed by the Danbury IAP area, which our health department program also covers. Give you a chance to look at the data. And then the next slide shows the trend rates for the IAP areas from 2020 to 2022. Again, showing the Norwalk and Danbury IAP areas maintain the highest rates in the state for those 3 years. And the next slide shows the overall 7 vaccine series for Norwalk IAP area children born in 2022 and the breakdown of the components. And it is definitely encouraging to see MMR and other component rates at such high levels. According to CDC, also, Connecticut ranked highest in the country this year for the 2-dose measles vaccination rate among kindergartners. The percentage of Connecticut kindergarten students receiving required measles, mumps, and rubella vaccine in the 2024 to 2025 school year is 98.3%. And this is an increase of 0.5% from the previous year. So Connecticut is above the 95% threshold considered necessary for measles herd immunity this school year, which is great news. And then the next slide, just to discuss some of the activities that we're involved with to maintain and elevate vaccination rates, is that we definitely work closely with all our providers to access their monthly reminder recall reports that Connecticut Department of Public Health runs for them in CTWIS. Again, for children 7 and 19 months of age, those tend to be critical times when they might fall behind schedule. And also with the MMR outbreaks in the country, the department ran MMR reminder recall reports for patients 4 to 7 years of age, so that they could start recalling any of those that still needed a dose. And additionally, our program, just for our area providers, we ran MMR reports also for patients 12 months of age in our catchment area to catch up anyone that was behind. We also encourage providers to recall late children promptly to facilitate series completion before age 2. We maintain late lists for all of the providers and follow up to ensure that children receive their needed vaccinations. We do outreach on children who are lost to follow-up, and that consists of phone calls to all contacts listed in CTWiz. We do internet searches through social media, white pages, etc. We check with the WIC program as a last resort, we make home visits. And if need be, inquire with neighbors if the family still resides at that address. And I'm glad to report our outreach efficacy has and continues to be 100%. And we ensure children in CTWiz without a medical home are connected to a provider and are up to date. And we encourage and enlist providers to participate in CDC's, it's called IQIP, which is the Immunization Quality Improvement for Providers program, where they select strategies to implement to raise their coverage rates. We work with them over a course of a year where we run initial rates in CTWiz for them to get a baseline. They pick strategies and we develop action items to meet those strategies. And over the course of the year, hopefully their rates increase, and usually that does happen, and several of the providers actually sign up for a following year because they're very excited about their progress. And we ensure complete and clean data in CTWiz, and that's through legacy, making sure that legacy load imports happen from their electronic health records. Many times when the providers onboarded to CTWiz, all of the historical data did not get loaded. And so kids have incomplete vaccination records. So we work with the providers to make sure that that missing data comes in, or that they're entering the missing data. And we educate providers to manage their patient's status in the system. So if children have transferred, it's important for them to inactivate them in CTWiz so that they are no longer followed in the system and no longer are in a denominator when we run rates. And then the next slide, just talking about the ACIP, the Advisory Committee on Immunization Practices, recently met on September 18th and 19th to discuss COVID-19 vaccines, hepatitis B birth dose, and the MMRV vaccine for children younger than 4 years of age. So what they voted on and approved were that COVID-19 vaccines were recommended based on individual decision-making for all individuals 6 months of age and older, with emphasis that the risk-benefit of vaccination in individuals under age 65 is most favorable for those who are at an increased risk for severe COVID-19 and lowest for individuals who are not at increased risk, according to the CDC list of COVID-19 risk factors. On CDC's adult and child immunization schedules, individual decision-making is referred to as vaccination based on shared clinical decision-making that includes physicians, nurses, and pharmacists. The coverage is allowed through all payment mechanisms, including entitlement programs such as Vaccines for Children program, the CHIP program, Children's Health Insurance Program, Medicaid and Medicare, as well as insurance plans through the Federal Health Insurance Marketplace. They voted to recommend CDC to add language. So in other words, update the COVID-19 VIS, Vaccine Information Statement, to describe risk factors and uncertainties related to the vaccine, and healthcare providers should discuss those risks and benefits with the patients. Luckily, a vote failed to require a prescription for COVID-19 vaccinations. Several members commented that this would have been a huge barrier to access. And in Connecticut, most pharmacies have the COVID-19 vaccine. And yesterday, the Connecticut Vaccine Program sent out a notification to the providers that they can now start ordering COVID vaccine for their patients 6 months through 18 years of age. So that's great news. In the beginning, it will be on an allocation basis, but as more vaccine is available, that will no longer be the case. They also were considering ACIP changing the administration of the first dose of hepatitis B. Yeah, thank you. To 1 month of age rather than at birth. The vote was tabled indefinitely due to the lack of clear evidence to change the schedule, and the wording was unclear. And there was a unanimous vote that all pregnant women be screened for hepatitis B, which is already the standard of care in the US and many other countries. And as far as the MMRV, the measles, mumps, rubella, varicella combined vaccine known as ProQuad, they voted to recommend that vaccine only be given to those over the age of 4 years. They removed the option of giving it at 1 year of age due to the slight increased risk of febrile seizures, and removed it from VFC coverage for this age group. MMRV at age 4 is still recommended and covered. And that's just a picture of my 2 grandbabies who are fully vaccinated. And thank you very much.
Thank you so much, Pam, for a great update, very informative, important updates, and just congratulations to you and the team for all your successes. You guys are amazing. Norwalk is really lucky to have you. Thank you for all your work.
Thank you.
Do any board members have any comments or questions?
I had 2 quick questions. First, thank you. I learned a lot from that. I appreciate hearing the background, especially. One, just out of curiosity, why Norwalk covers Danbury when Danbury has its own health department?
Good question. Danbury used to be covered by the VNA in Danbury. The Danbury Health Department felt at the time it was not able to take that on. They don't really have that many clinical services in Danbury. And when Danbury VNA gave up the contract, Danbury Health Department was again offered to have the program, which they declined at the time. I think maybe today they might accept it at some point, but back then they felt they couldn't take the program over. So we decided, because we share hospital networks and whatnot, that we would take on the program.
Yeah, okay, I'm just curious. And then, I mean, you started talking about this toward the end. I'm just curious what the thinking is now that there are, how I'm going to put this, now that there's criticism of the ACIP and other professional groups like the AAP kind of putting out their own guidance that is not consistent with the ACIP, how that may, like, is DPH thinking about, you know, how that might influence the way they analyze their data and report their data, because you're basing your data, your analysis on the recommendations, and now for the first time there is more than one kind of, I'll say, professional set of standards.
Correct.
Right?
Yes. Yep. I think they probably will recognize that when we do report rates, and that it's the recommendations that we are following are from which professional organizations.
Mm-hmm. Yeah, I would encourage them to do that, not recognize the ACIP, but to recognize the other groups
Correct.
of committed scientists who, specialize in these areas, who are saying that, something like maybe the table has more than one column, right? Like if you look at the data, the ACIP way, it's this. If it's the AAP way, it's this way.
Right.
I think, you guys do a very good job, and I think your data will be very favorable regardless of whose definition you use. But, this is a new era we're in now, where there's, like I said, more than one kind of professional opinion that's being adopted.
Right. Exactly. It's a very good point.
Thanks, Anthony. Any other questions?
I don't have a question. I just have
Norman, I think I heard you and then I lost you.
I'm sorry. I didn't have a question, just a comment. I think Anthony brought it up very well. First of all, Pam, I think you did a great job, but I think it's important to understand that this information about vaccinations, particularly in Norwalk, has been greatly spread and communicated to the community through physicians and through the health department, and it is a great job. I think that there is this disparity between recommendations, and I think we have to be cognizant of it. And being informed that I think that Anthony's suggestion is well taken.
Thanks, Norman. All right, hearing no other comments, we can move on to the next item on the agenda. Thanks, Pam. Thank you so much, Sarah. We're going to move on to Brian's updates for epidemiology. Good morning, Brian.
Hey, good morning, Deanna. Good morning, board. Good morning, everybody. So just kind of, it's going to be a little bit longer in terms of the overview because we're going to jump from subject to subject. So we're going to be looking at respiratory viruses, quickly jump into vector-borne, CDC Health Alert Network messages, a little bit about travel, and a little bit about environmental health. So with that said, I'm going to move quickly through each of these just to get the immediate information that we need to take away from it. So starting off, this is our CDC community snapshot, zooming in strictly to Connecticut. Respiratory illness activity in Connecticut's at low and not very low, so things are slowly picking up. And so emergency department visits right now for COVID are low, flu, RSV very low, but generally for COVID and flu, it is an increasing trend based upon the information that is being received, and that's for emergency department visits. Zoom down a little bit more, we go look at the wastewater monitoring, and we have COVID-19 at very high, which it's been at for quite a few weeks now. Especially since when schools kind of got, started up again and summer season kind of wrapped up. But then we're also, we're at very low for flu and RSV in terms of that activity for wastewater monitoring. But again, COVID activity is up there. And so with that said, looking at, a broader surveillance from the CDC, this is our NRE VSS dashboard, weekly percent of positive tests. Big takeaway here from a national perspective is definitely, rhinovirus and enteroviruses have, continued upward and, what was initially a very steep spike, but then also still has an uptrend right now. SARS-CoV-2 is, dropping off a little bit, but its activity is still higher than usual relative to, where it could be in baseline activity. And so a lot of the other viruses are also kind of circulating too, but at lower levels, not quite at baseline, but mostly there. So that's like parainfluenza virus, you're talking about adenoviruses and things of that nature. So they are circulating still. And that's the point to really take away from here. And again, all this kind of gets summarized, and the CDC, still maintains this infographic, which I think is a really great way just to at least get everything into a standardized format. And as we're kind of familiar with the federal government kind of, changing the game in terms of what standardization means. With that said, as a reminder, immunizations, respiratory and hand hygiene, cleaner air with air filtration, opening the windows, treatments where appropriate, and where available, again, so that's flu antivirals, COVID antivirals, things of that nature. Staying home and preventing the spread. So that's the most important thing. Wait until your symptoms are better and you're fever-free without a fever-reducing medications for 24 hours, then taking 5 days of those precautions with the masking. Distancing from others, especially more vulnerable individuals, events and other opportunities where a lot of individuals could be running the risk of exposure, and then testing oneself to kind of figure out one's viral shedding situation, right? And then obviously following with the healthcare provider is important too. So that's, I think, again, a very great infographic, important point to hit home. The epidemiology for masking has already been proven. So everybody can relay this message and has been doing from the public health lens. So that includes our community health workers, our clinicians, health educators, and other people that engage the community. And so this is just, again, a reminder for our technical audience during this meeting. With that said, now we're switching gears to the vector-borne disease situation, specifically looking at mosquitoes. This is a map for the state of Connecticut, looking at the current year's West Nile virus positive mosquito activity. We zoom into Connecticut because, as you know, Lower Fairfield County has been having a lot of activity relative to mosquitoes testing positive. We have about 7 in total relative to the surveillance that the state does. But you can see how, again, we have the kind of stereotypical picture, Lower Fairfield County having the largest density, but then also New Haven County and then Hartford counties kind of falling in that turn. And that's how the season played out. And so we look at it in the kind of the statewide lens, you can see the trends of how things have played out. So the trend line that you're seeing here is the 19-year average of weekly detections for West Nile virus positive mosquitoes. And then for the bar chart component, that is how our season's been playing out this year. And as you can see, we were much higher, especially during the peak of it in August, relative to bird biting and mammal biting mosquitoes. Very fortunately, though, again, it would be great if it was 0. We had a lower number of human cases detected at this time. So that was 2, 1 in August, 1 in September. But generally speaking, you can say that our activity for this season has been higher than that 19-year average that we compare it to and benchmark it at. So it's just an important point. We're still not fully all the way through the season, so we just have a little bit more to close out because even later this week, it goes down to even 39 degrees at night, but not quite at freezing, but getting pretty much there to hopefully kind of drop off the mosquito activity for the remainder of the season. So again, just a reminder about mosquito prevention from our Norwalk Health Department webpage. And again, just kind of the standard procedure in terms of insect repellents that's approved by the EPA. Now with the colder weather, especially in the evening, a lot easier to wear long sleeves, long pants. And again, just reducing their opportunities to establish themselves in the habitats. So any other pockets of water and standing water that exist, making sure you clear that out. We have educational materials in English and Spanish in here, including videos along with the prevention tips. Then switching gears now, just wanted to mention, the CDC has released a Health Alert Network message back in mid-September. And so this was in regards to just general awareness about Ebola virus disease in the DRC, Democratic Republic of Congo. Right now, if we switch over to the current update relative to that situation, we have, in terms of latter September, that surveillance, about 64 confirmed or probable cases, which includes about 42 deaths related to this. So again, we've seen this come out year by year. CDC is monitoring this, and it's good that the CDC is still releasing Health Alert Network messages. And the fact that they're doing it should also raise just general awareness there. It just emphasizes the point about travel. Anybody, traveling to the DRC, they be mindful of this. Anybody coming back, especially if they were a volunteer or a healthcare provider in especially the regions that are experiencing that higher activity, that's going to be really important. But then again, it emphasizes anybody that's traveling just to check the travel health notices relative to the different levels that the CDC maintains. And so again, we have a lot in level 2, especially related to chikungunya. We got yellow fever, from a natural perspective, even polio that we're keeping an eye out for, a lot of vaccine preventable diseases. And so it's really important people are up to date with that. Emphasize that point again with travel or people coming from other countries where it's endemic. And so, yeah, again, this Ebola notice is also now in that mix. So I just wanted to emphasize that point. And then along with that, our health department travel and adult immunizations clinics. And so we offer a lot of vaccines and, travel related ones, especially. And so, please do follow up with us if you need any, or you just want to check to make sure you're kind of up to date with everything. That's going to be really important. So that is all there relative to our health department website. Now switching gears just really quickly relative to environmental health, just jumping back to the air quality monitor hub that we have here for the Norwalk Health Department and for the city. Just kind of zooming in on what our situation is. Overall, generally speaking, we're currently at an AQI 39, which is good. We're in the green level. So generally everybody's in kind of a good spot relative to that, although we jump into just a little bit of the yellow or moderate, a couple days here and there. So that again is encompassing, particulate matter 2.5, particulate matter 10, and then along with that ozone level. So again, we're doing well right now relative to that. And then in terms of the forecast, and you could kind of see no wildfire smoke per se, but it is like pollution kind of par for the course, where things do kind of uptick a little bit, maybe to the moderate level. So I just want to emphasize that point, not to go through the whole webpage, because again, you don't want to take up too much time. Just being mindful also, we still have allergy seasons that we're dealing with. So right now, what's going around in Norwalk and going on in Norwalk is ragweed and sagebrush. But at least, the levels are low medium relative to pollen.com, and then switching over to our extreme heat and drought monitor hub. Again, specific to Norwalk, looking at, the weather, somebody else can kind of delve into that. Again, we're just looking at for extreme heat right now. Fortunately, only minor activity for Wednesday, but then little or none for the remainder of the week in terms of the forecast for heat risk. So that's good. Again, par for the course because we're in the fall time. The other thing I did want to mention from an environmental perspective is just also the drought monitor. So right now, Connecticut is experiencing an abnormally dry, mostly Connecticut, a dry situation right now relative to drought. So we're not at none where our water levels are, perfectly fine and safe level. So we are, wanting for a little bit of extra precipitation just because we're experiencing abnormally dry conditions, but it is not drought conditions yet, but it is potentially leading that direction. So just wanted to share that as well, because again, that is also potentially not only related to heat, but also precipitation, which is important for us, but that helps also offset potentially standing water situations for mosquitoes. So you can see the trade-off that we always have to deal with in terms of public health, along with even in the public domain, especially in terms of the federal level and things of that nature. So a lot of things that we're having a tug of war with and contending with, and then obviously presenting with a balance of what is the current circumstances. So with that said, this is the kind of, the overall respiratory situation is slowly picking up. We have COVID kind of being the primary driver right now, especially with the wastewater monitoring, but we are seeing that uptick of COVID and flu and ED visits in Connecticut. Then switching gears again, with mosquito-borne disease, we're almost near the end of the season, so let's just do our best to keep those human case numbers low. But again, we did experience a little bit higher season compared to the 19-year weekly average. In terms of Ebola and the Health Alert Network messages, we have to be mindful of that, but then that's just a good reminder about travel health and how that also relates to like Pam's presentation about immunizations and, just taking those very easy prevention measures to mitigate severe disease and also outbreaks and spread. Because we are experiencing measles outbreaks even in like Utah, Arizona, even in Ohio right now. So that's something else for us to kind of keep in mind. Then along with that, just from our mental health perspective, right now we are experiencing good air quality, and that's great to see, and let's kind of keep it that way. Pollen and allergy levels, we do still have some allergens, but nothing too extreme right now. And then along with the extreme heat, fortunately out of that in terms of experiencing more fall time weather, but we do need to be mindful of conserving water because we are in abnormally dry conditions in Fairfield County and most of Connecticut. So that is the overview for today. Thank you, everybody. Have a great rest of the day.
Thank you so much, Brian, for all those really great updates. Does anybody have any questions for Brian? All right. Thank you. Next item on the agenda is flu clinic. So I want to thank Joan McNeil, who is one of our volunteers. She's been volunteering at our flu clinic, so you may see her there. So thank you, Joan. And we also had Anthony and Ken join us last week to help promote the clinics. We had our first flu clinic last week, so thank you both for being there to help promote. Sent out a press release yesterday, and we have some social media posts going. But we're offering our flu clinics in the month of October. Our next one is going to be this Thursday from 4 to 7 p.m. We have another one on October 16th from 4 to 7 p.m. So and then from there, we're going to offer them in the afternoons on Thursdays. So appointments, we're asking for people to register beforehand to make it a faster, easier experience. But we also, at our last clinic, we did accept some walk-ins, so it's great to see some people who saw our signs and were interested in getting vaccinated. So we're trying to get the word out about that, and we'll continue to offer them while we have the vaccine. So thank you again for the board for your support and joining the local state elected officials as well to promote, with the mayor and Senator Duff. We had Representative Johnson, we had Council Member Jalen Seed, and we had our board members represent. So that was great. I do also want to mention that, our team is fantastic in looking about how we organize these clinics to make it the best experience it can be for the patient, for the public that are coming, to make it fast and quick. And so we're always looking at it as, like through a quality improvement lens. And this time we're utilizing the ICS structure, the incident command structure. And so we're using that to organize the different roles and positions within the clinic. And we exercised that last week, and we thought it went really well, and it was a big improvement from the last time. So we're always looking to ways we can improve and make it a good experience for the public. So thank you to the staff for all they're doing those clinics.
As a consumer, a person who walked through it, I just want to say it was really nicely organized. Ken and I had an easy time kind of walking through. You had all hands on deck. It was really seamless. So it was really nice to see that.
Thank you. Appreciate that. It's funny when we look at we were met a couple of us to look at like improvement areas. Aniela was our planning chief, and so she was taking diligent notes about what was going well, what was not going well, and so she had pages of things that we wanted to improve. So it's great to hear that it was a good experience on your end, but we're always looking to see how can we make it even better. But that's fantastic feedback, Anthony. Thank you. All right, so the last item for me is the director's report. So I just wanted to, given all the what's going on at the federal level with the budgets, just wanted to give you some update on some of our funding. So WIC, thankfully Governor Lamont is being amazing, and so is Commissioner Jatani, about looking for ways we can keep the WIC program funded and moving throughout this pause. So just really want to thank the state of Connecticut for all the support that they're doing for the WIC program in the meantime. So we're working really closely with Optimist, who we subcontract with to offer the WIC program. So we're continuing to offer that. We also heard through the state of Connecticut that they did receive all of the preparedness funding for the remainder of this fiscal year, which goes to the end of June 30th. So they're able to still access those funds. So we're able to keep going with our preparedness work. And we also heard from the state and the United Way that they want to extend our suicide prevention grant. That's been extremely successful. A lot of great work has been going on with that. So we're looking to create a new contract with the United Way, who we will subcontract with, to be able to offer that for an additional year. So those are just some funding updates for us. Also, we're starting to be able to offer more internships for students. So thank you to Aniela and the senior management team, all they're doing to create opportunities. Also with the state health department too, that offers fellowships to find opportunities for students to volunteer or to intern at the health department. And so we have a great process. We're able to we have a form online where students can fill out what they're interested in, and they're able to meet with our staff to see if we would be a good fit for them. And we also have several universities that we have agreements with, like Fairfield University, so it makes it easier to be able to take students on. So just want to say that that's been going really well for the fall. And I think those are my main updates. Anybody have any questions? All right. Is there anything else before we adjourn today? All right. Thank you again for being accommodating and being able to reschedule for this week. And I'll see you in a few weeks for our October meeting.
Okay.
Our second October meeting. Thank you, everyone. Have a great day.
Okay.
Bye.